Hey there, my name's Houston Hutchison. I'm a lieutenant paramedic with Peachtree City Fire Rescue. Today I'm going to be talking about the role of a PIO or Public Information Officer and how they work with the media and community to share information during emergencies. My role as a PIO is to act as a communication link between my agency, the media, and the community. During emergencies, people want information quickly, but my role as a PIO is to make sure that information is accurate and being released responsibly. Um, Occasionally, we also provide details on the services that our department provides and some safety topics for the public. The PIO role is helpful to any agency because it keeps communication consistent and organized. It allows our firefighters to focus on the incident at hand and patient care rather than having to deal with the media. Having one person in charge of the information being released also helps prevent misinformation. Anytime there's a major incident, there's going to be rumors, there's confusion in the public, and the PIO role helps mitigate that. Maintaining a positive image is very important for any public safety agency. The community needs to trust its people that it's calling for help. When we communicate, it needs to be professional and clear. That helps build that trust. It also helps the community understand what we do and why certain safety measures are important. Our policy here at Peachtree City Fire Rescue is that media requests go through the PIO or incident command staff. We try to be as quick as possible to respond to these requests, but we want to make sure that the information we're releasing is accurate. We're also trying to protect patient privacy and make sure the emergency scene stays safe. Incidents that usually attract media attention are serious structure fires, major car accidents, incidents that involve multiple patients, such as hazmat, or major weather events. In these scenarios, the PIO is in charge of all media requests. They are also able to give out information on what the responders are doing to mitigate the situation and if there's any danger to the public. The public information officer can share general information as to what happened, such as the location and time and how many units responded. We can also give general updates on the situation and provide any safety details to the public if there is any danger. The goal is to keep everyone informed without violating privacy. Certain information does remain confidential, especially anything related to the patient's identity or medical history. All healthcare providers follow HIPAA, which protects patient privacy. That means we can't release patient names, medical history, or anything that could identify the patient. My recommendation for any journalist working with a PIO is to work directly with that PIO. Generally, you can find their information on the department website. If it's a major incident, the PIO will likely be at the incident to answer questions as best they can. We understand the media has a job to do, but we also have a job to do. Being patient with us allows us to gather information and confirm that the information is accurate before we release it to the public.